To some new concerns about a popular hair loss treatment. The medication is finasteride, which is sold under the generic name Propecia. It's a hair loss treatment often marketed to young men for male pattern baldness. Doctors have warned about the potential side effects, but an article out today from the Wall Street Journal highlights how the medication is now widely marketed and more accessible through social media and telehealth companies. Unlike drug makers, those companies, the Journal says, are not required to disclose potential side effects in their advertisements. NBC News medical analyst Dr. Vin Gupta joins us now for more. So, Dr. Gupta, first off, talk to us about finasteride. What are the benefits, and really, how severe are the side effects?
Yes, and Clay, this is ubiquitous as a treatment for hair loss and male pattern baldness specifically. Very widely available, and it's shown some efficacy, which is why people are utilizing it at low doses. And so that's number one. That's the primary indication. It has been used for other indications seemingly unrelated to hair loss, things like benign prostatic hypertrophy, retention, urinary retention, in other words. Your audience may know a loved one or may be experiencing that by themselves. But those are the indications. And, critics do say the side effects might be overstated. But I would say as a clinician, I do worry about potential side effects like sexual dysfunction. We know that this impacts your hormonal axis and could potentially impact sexual dysfunction, just overall functioning. Cognitive impairment is a big concern. And so those are really the main concerns here. But again, if prescribed by a prescribing physician, those can be managed.
So if someone is ordering treatment through a telehealth company, say, why might they not be aware of these potential side effects?
Because the telehealth companies in a 30-second advertisement on TV just talk about the benefits that we just talked about, addressing things like baldness, vanity issues, and they don't really get into the side effects whatsoever. So that's why it's important to understand all forms of hair loss might have an underlying cause like stress. There might be a genetic predisposition. There could be other reasons why somebody's exhibiting hair loss. And it's important to understand, is treatment appropriate? In every indication of hair loss, finasteride might not be the solution.
So to that end, I know some clinicians have also warned about a condition known as post-finasteride syndrome. What should people know about that? And just generally, what should people do to stay healthy if they are ordering medication to their door?
Yeah, what I would say is this post-finasteride syndrome, what it really is if you immediately discontinue it, there are concerns that it causes hormonal imbalances, neurotransmitter imbalances in your brain, and potentially it might lead to mood disorders. It might lead to sexual dysfunction. It might lead to overall fatigue. That's the concern. We're still understanding it. Treatments are multimodal, but again, it's not totally clear this syndrome, although a lot of people have been impacted by it. So we're learning more as we speak. In terms of if you're going to get this treatment, make sure you're doing it under a prescribing physician.
Always great information. Dr. Vin Gupta, thanks so much.